Hi, my name is
Hello.
Gracie Felker. What's your name?
I'm Dr. Wistman. And I'm Dr. Stegerman.
Awesome. So nice to meet you guys. We hold this for just a second. Sorry.
Sure.
I took off my jacket. How are you guys doing today?
Good, how are you? Good.
Good. I'm also good. Just a little tired, but I'm happy to be here. So,
you are?
today I wanted to talk to you guys about Veozah. It's a drug that helps with vasomotor symptoms. Would you guys be interested in hearing about it?
Yeah, of course.
Awesome. So I did create you guys a little pamphlet to help with everything. It just kind of has the highlights and obviously the price at the bottom.
Okay, thank you.
But basically Veozah is a medication that is taken once orally. It's a 45 milligram pill, and basically it's used to treat vasomotor symptoms, and it does that by targeting the NK3 receptor that creates the hot flashes and the night sweats, just directly addressing the root of the problem and providing a fast and effective relief. So.
Okay, thank you so much for sharing that with us. Currently, our gold standard against moderate to severe vasomotor symptoms, like hot flashes, is hormone replacement therapy, but we do understand that there are some patients who are obviously reluctant to HRT or just have contraindications like breast cancer. In that case, I would probably prescribe Brisdel, also a brand name known as paroxetine. This is an SSRI that was FDA approved back in 2013, has great safety profiles, and is generally very affordable. So I would just love to know why your drug is superior.
Yeah, and I'm glad you asked that. So I think the main thing that sets Veozah apart from other drugs is the fact that it is just so innovative. Like I said, it really attacks the root of the problem, unlike other drugs, and it is shown to be highly effective in clinical trials, alleviating symptoms within only a few weeks, and demonstrating really quick reductions in severity and longevity, frequency of vasomotor symptoms. So that's kind of why I would say it sets itself apart.
But awesome. Thank you so much for hitting more on the efficacy of Veozah. So one concern that I did have, according to your pamphlet, was the liver concerns that come along with taking Veozah. So I see that before you can even prescribe Veozah, patients must undergo hepatic testing to make sure that their liver function is good enough to start the treatment. And then after beginning Veozah, they have to be monitored every 3, 6, and 9 months after starting the drug, just to make sure their liver function is still appropriate. And my biggest concern regarding that is for my patients who have to travel farther to get to the hospital for these tests. So how would you address this issue, and as well as other side effects and contraindications to Veozah?
Right, that's completely valid. I totally understand your concern there. I would say that you guys did mention hormone replacement therapy was a common way that you guys normally treat vasomotor symptoms. So I do know that for that that type of therapy, they actually require periodic monitoring of the health impacts of it. And so in that sense, patients are already coming into the office. So for those kind of patients, then this may be a viable option. And as for the other safety concerns on Veozah, there have been some adverse effects. However, it's been generally well tolerated, and when there were adverse effects, they were typically mild to moderate effects. So you don't have to worry about any severe issues. Typically, and then also patients with psoriasis, severe renal impairment, and concurrent use of CYP2 inhibitors should also not take Veozah. However, our main concern was likely just the liver problems. But overall, as for safety, it's a really great option, just because there's a lot of women who are at risk for estrogen related or estrogen sensitive cancers and things like that, and so I think it offers a lot of different ways that it is safe in other aspects. So
awesome. Thank you for addressing that concern. And then another concern that I did have had to do with the price. So obviously $450 a month is a lot to ask of our patients, as some people may not be able to afford that. So what are some ways that you could address this barrier and make it more accessible to all patient populations?
Right. Again, that's completely valid. I would say that for patients that are eligible, they can get a copay to help them pay for the out-of-pocket costs, and also insurance will vary, of course, to help pay. Additionally, it's just a newly approved drug, so it'll hopefully be more cost effective over time. It was approved in 2023. And it's just the price is really representative of the quality of the drug and the innovative side of it. So we think that $450 a month is pretty fair for some people. However, we understand that, and we would be willing to give it at a discount. And with the implementation of a discount and potentially some free samples for some patients that you guys might have that are dealing with vasomotor symptoms, would you guys be willing to consider Veoza as one of your medication options?
Yeah, so there's just a lot to consider when it comes to prescribing medications for patients in general.
Right.
For example, if I were to have a patient come in with both nerve pain and VMS, I'm probably going to prescribe gabapentin just because it can
Right.
be effective dual purposely and just make my patient's medication regimen as simple as possible.
Right.
However, if a patient were to come in with all of the things that show that they align with the needs that Veoza is able to address, I would definitely consider it as a non-hormonal option, and we would love to take some samples.
Yeah.
Awesome. Thank you guys so much.
Nice to meet you.
Thank you. Nice
Nice
to meet you.
you. Okay.